Topic 2 addresses evaluation and assessment. In this topic, we will describe the purpose of evaluation and assessment, we'll share information about how to conduct a functional assessment, and you will have the opportunity to watch and analyze a video of a functional assessment. The initial contact is actually the first step in the assessment process. In this section, we'll be sharing with you information about considerations for the initial contact, the purpose of the initial contact, and we'll also provide you with a script for how to introduce both the program and the process to families.
The initial conversation takes place between the service coordinator and parents, care providers, and any other important adults in the life of the child. This conversation most often occurs in the child's home or child care setting at a time convenient for the family. Topics include specific information about your individual program, as well as the use of evidence-based practices, including the importance of natural learning opportunities, the roles of the adults, and how team members work together. The initial conversation has several purposes. This is a time where the service coordinator is pulling together information about the child's potential eligibility. The service coordinator will also initiate the assessment process by gathering information about the child and family's routines, activities, and interests, which will be used as part of further assessment. Many times people ask us what specifically to say in order to explain an evidence-based approach to early intervention. This link will take you to a script that may be used to describe how early intervention is implemented according to the federal regulations, as well as mission and key principles for providing supports in natural environments, and Georgia Babies Can't Wait policies and procedures.
Because programs may vary slightly across districts, take some time to find out how the initial conversations are conducted in your area. This will include who has the initial conversation and how this person goes about explaining the program. You should also find out what information the person conducting the initial conversation begins to gather, and how this information is then shared with the rest of the team prior to the evaluation and assessment.
Under Part C of the Individuals with Disabilities Education Act, IDEA, evaluation and assessment are defined as two separate processes. Evaluation is defined as how the program determines the child's eligibility, whereas assessment includes all of the information gathered to develop the Individualized Family Service Plan, the IFSP. Due to the 45-day timeline, programs often only have time to focus on eligibility and then move directly to the IFSP. Federal regulations, however, emphasize the importance of implementing the procedures necessary to identify strengths, needs, and participation-based outcomes that lead to improved child and family functioning. See your early intervention coordinator or other Babies Can't Wait resources for more information about multidisciplinary evaluation. This module will provide you with further information about functional assessment. The links provided in the next 3 slides lead to resources for gathering information about child and family interests, activity settings, and routines. This information is used to identify areas of focus for further assessment, help develop the IFSP, and serve as a starting point for intervention. For example, if during administration of one of these procedures with a family, the parent shared that they're unable to go anywhere in the car as a family because their child refuses to ride in his car seat, the discussion could lead to assessment of a car ride prior to the IFSP meeting. The Asset-Based Context Matrix, or ABC Matrix, specifically identifies child strengths and interests, activity settings within the home, community, and early childhood settings, and then leads to a conversation about meaningful and functional interactions, current participation, and then possibilities for enhanced participation in existing and new activities. The interest-based checklists specifically identify activity settings in which a child's interests may occur. The interest-based activity settings then lead to context for intervention. This tool provides 3 checklists organized by age of the child: birth to 15 months, 15 to 36 months, and 36 to 60 months. The routines-based interview, or RBI, is a conversational process that involves 6 steps that begin with talking about the day-to-day life of the child and family to assist parents and care providers in focusing on their priorities for the children in their care and to help them to develop a plan. By talking about everyday situations, family members and care providers are asked to choose the things that are most meaningful to them. For more information about the tool or to receive further training, follow the link provided.
The information gathered from the initial conversation and the tool or tools discussed previously is then shared with other team members who will be participating in the evaluation to determine the child's eligibility for early intervention, as well as the assessment that will be used to develop the individualized family service plan. Think about your own team and consider the answers to the following questions. When will the evaluation occur? As opposed to, when will assessment occur? Who on your team will do the evaluation? And what's the rationale for those individuals? Then consider who will do the assessment, and why would it be most appropriate for that person or those persons to participate in that? Where will the evaluation take place, and why? And then, where will the assessment need to take place, and what's the reason for that? What will happen specifically as part of the evaluation? And then what will need to occur as part of the assessment?
In order to be mindful of the 45-day timeline and gather the information necessary to identify participation-based IFSP outcomes, 3 visits are recommended as best practice from the initial visit with the family to completion of the IFSP. The first visit, as we discussed, begins with that initial contact with the family and assessment starts during that conversation. The second visit focuses on evaluation to determine eligibility, and the third visit is a combination of functional assessment and actually writing the IFSP. In districts where extreme drive time exists, exceptions can be made, but if the visit is going to last longer than 90 minutes, the family should be informed prior to the visit, and breaks for the child and family should be included. Evaluation, as described in the previous slide, includes the procedures used to determine a child's initial eligibility for services. The evaluation must be multidisciplinary, including at least 2 different disciplines who implement at least 2 different procedures that cover all 5 areas of development. Now remember, procedures does not mean actually 2 tests, but can include systematic observation, family interview, and even includes review of medical records. Evaluation should be conducted in the home or other natural environment on the same date and the same time, and parents must be involved in the evaluation process and should be notified of the results of the evaluation immediately. Assessment occurs during Visit 3 as described on the previous slide. An assessment is about gathering further information that focuses on activity settings and priorities that have identified by the family. Team members are selected to be involved with further assessment based on their expertise and what they can offer to the family. We want the assessment to be about real-life observation of what parents and other care providers would be doing if we weren't there, so what their role is during that routine or activity setting. Practitioners should be prepared to try out strategies or new ideas during the assessment.
We would now like for you to view a video of a functional assessment in a child care setting. Prior to watching the video, however, we would like for you to review the handout, which is a script of the planning conversation. As you watch the video, consider these 4 questions related to the activity, the role of the practitioner, the role of the teacher, and the plan agreed to between the practitioner and teacher at the end of the assessment. The functional assessment you just viewed on video occurred during the mealtime routine at the Child Care Center. You observed the practitioner trying a number of different strategies during this activity. The strategies included use of several different versions of adapted cups, a couple of different adapted utensils, as well as the use of non-slip surfaces under the plate and in the child's seat. The practitioner asked the teacher questions about how this setting typically occurred and her ideas to improve the child's participation, and also answered the teacher's questions about things that she could be doing to further support the child's ability to be in the seat and more adequately feed himself. The practitioner and teacher both assessed the effectiveness of the strategies introduced and tried by the practitioner. The role of the teacher during this time was to do what she would typically do to support the child during the mealtime routine. To view the plan developed between the teacher and the practitioner, read the handout Debriefing the Assessment in a Child Care Setting, which includes a script that reveals the plan developed between the two. Now that you've reviewed the information about evaluation and assessment, as well as reviewed a video of a functional assessment in a child care setting, you may now have the answers to or realize that you need more information about the following questions. Should you need more information, talk with your early intervention coordinator or other members of your team.
A separate evaluation or assessment report is not required by the Babies Can't Wait program, as the Individualized Family Service Plan serves this purpose. If, however, a practitioner needs documentation for a third-party payer, physician, or to meet licensure requirements, then a report may be necessary. Further, if a parent specifically requests a report, then the team will generate a report for the family. Reports other than the IFSP are written for the specific audience intended. For example, a report to a third-party payer would need to be skill and deficit-based in order to justify the need for the practitioner to be involved and to bill. A report for a physician would be organized around the reason for the referral and limited to 1 to 2 pages at most. A report for the family should be asset-based and written around the IFSP outcome statements, as these are based on the family's priorities. All members of the team should contribute to one unified report. Based on the information you've just heard about writing reports in the Babies Can't Wait program, take a few minutes to sit down with your early intervention coordinator and discuss how this information matches the process in your individual program or district. You've now completed Topic 2. When you're ready, move on to Topic 3, the Individualized Family Service Plan.